Welcome to this clinical walkthrough on the osteoporosis medication counseling case for UKMLA, brought to you by Medi8, your 24/7 practice partner. All right, so here's our game plan. We're going to tackle this classic medication counseling station using the CARE framework. That's going to guide us through clarifying the concern, assessing the background, reassuring and explaining, and then educating with a solid plan. We'll start with the scenario and then work our way through each step.
So let's set the scene. Imagine you're an FY2 doctor on an orthopedic ward. Your next task is to talk a patient through her new medications just before she goes home. This is a super common and really important station to master.
Okay, let's get to know our patient. We've got a 70-year-old woman who's been admitted with a pelvic fracture after a fall. She's now been diagnosed with osteoporosis. Now, pay close attention to the social history. She lives alone and her home has stairs. That's a huge red flag for future falls. And what's on her mind? She's worried about the side effects of her new meds. Every single one of these details is a clue for how to handle this consultation.
First up is C for clarify concern. This first step is everything, you know? It sets the tone for the entire conversation. Your goal here is to introduce yourself properly, and then get right to the heart of what's worrying your patient. Think of these as your first 3 moves to build trust right away. You introduce yourself, you confirm you're speaking to the right person, and you clearly state why you're there. Simple, but so effective. You're going to want to use phrasing exactly like this. It's professional and gets straight to the point. You'll say, "Hello, my name is Dr. So-and-so, one of the doctors here on the ward." And once you've confirmed her details, you can say, "I'm here to go through those new medications with you." This question is gold. Why? Because you're immediately assessing her baseline knowledge. You can't assume she knows anything or everything, so this helps you tailor your explanation perfectly. And here is the absolute key for any OSCE station. You have to ask what she wants to get out of the conversation. This question is how you uncover the patient's agenda. It shows the examiner you're practicing patient-centered care, and that's where the points are. When you ask, she's likely going to tell you her biggest worries are side effects and how on earth she's going to manage this at home by herself. Perfect. Now you have a clear roadmap for the rest of your consultation, built entirely around her needs. Okay, so we've clarified her concerns. Now let's move on to A for assess. We know what she's worried about, so now we need to gather a focused history. This isn't a full medical school workup, it's targeted information about her osteoporosis and risk of falling again. So these are the things you've got to cover. You'll ask about her fall, check on her other health problems, and we'll use a couple of great mnemonics to make sure we don't miss anything. We'll go through MATHTOSA next, and don't forget DISA. That's diet, exercise, smoking, and alcohol. And always circle back to ICE, her ideas, concerns, and expectations. Let's apply MATHTOSA to our patient. For M's, she takes aspirin and lisinopril. Allergies, she has none. Family history is positive. Her mother also had osteoporosis. For timing and surgery, she just had her fracture fixed. Occupation, she's retired. Social history, and this is a big one, she lives alone, and for activity, she finds stairs difficult. See how that mnemonic quickly paints a very clear and relevant picture? Okay, quick pause here. Knowing all these steps is one thing, but actually putting them into words in a high-pressure situation is another. You can practice this exact case right now and get objective feedback on Mediate.com. All right, this brings us to the real heart of the consultation, R, for reassure and explain. This is where you'll tackle her worries head-on by explaining the diagnosis and the medications in really simple, easy-to-understand language. The key here is absolutely no medical jargon. You're going to say something simple like, "Your bones have become thinner and less dense, making them more fragile and easier to break." It's a clear image that anyone can grasp. Now for the meds. We'll start with the big one, alendronate. I like to call it the bone strengthener. It frames it in a really positive way for the patient right from the start. Okay, listen up, because these instructions are absolutely critical. You have to be crystal clear. Number 1, it's only once a week, first thing in the morning on an empty stomach. Number 2, take it with a big glass of plain water, nothing else. Number 3, you must stay sitting up or standing for at least 30 minutes, no lying down. And number 4, no food, drink, or any other pills for those 30 minutes. Getting this right is key to making it work and avoiding side effects. When you talk about side effects, you want to be smart about it. You can link the common ones, like heartburn, directly to not following the instructions properly.
Then you have to mention the rare but serious ones. And here's a crucial safety point you cannot miss. Tell her she must let her dentist know she's taking this medication. Next up, the other new meds. Keep it super simple. Explain that vitamin D is like a helper that allows her body to use calcium to make her bones stronger. And paracetamol? That's just for the pain from her fracture. Simple roles for each one.
And don't forget her existing medications. It's so important to explain why things have changed. You'll want to say something like, we've lowered your lisinopril dose to help prevent any dizziness, which we don't want because it could lead to another fall. For her aspirin, just remind her that it's good for her heart, but to keep an eye out for any bleeding or bruising.
Now we're on the home stretch. We're going to close the loop with E for educate and plan. This isn't just dumping information on her. It's about working together to create a safe plan for when she gets home.
A great management plan has a few key parts. You'll talk about lifestyle stuff like diet and physio, but for this lady, the absolute game changer is getting an occupational therapist to do a home safety assessment. It's a non-negotiable given her living situation. Then you wrap up with clear safety netting advice on when to get help and a follow-up plan with her GP.
Okay, we are almost done. Before you finish, you must summarize the most important points and check that she's understood everything. This makes sure she leaves feeling capable and confident with the plan.
And you're going to end with a question just like this one. It's the perfect way to check for understanding one last time. Offering to write things down or giving her a leaflet is a fantastic touch that shows you really care. And that wraps up our walkthrough of this case. To put all this theory into action, you can practice this exact case now on mymediate.com.